Thank you for joining us on Health Diary. My name is Gladys Gashanja and we're coming to you from Mivede at Garden City. Now, I'd like you to imagine something with me. Imagine not being able to swallow, not being able to blink, or not being able to even control your bladder. Well, that is the reality some of the patients living with multiple sclerosis have to contend with. And on today's episode, we find out what MS is, which is the abbreviation for multiple sclerosis. But before we get to it, here now is a fact of the matter. Multiple sclerosis, abbreviated as MS, is a chronic rare disease that targets the central nervous system, the part responsible for the proper function of the brain and spinal cord. Damage to the brain and the spinal cord can lead to problems with vision, balance, muscle control, and other basic body functions. Symptoms, severity, and duration of multiple sclerosis can vary from person to person depending on the amount of nerve damage and nerves affected. There is no cure for multiple sclerosis. However, treatments can help speed recovery from attacks, modify the cause of a disease, and manage symptoms.
Kwa majina naitwa Michael Maina Wangoko na ilianza kwa kufanya kitu, lakini hiyo kitu haijafikia akili ati hiyo kitu imefanya. Kufanya kuja form 4 shida tupu bena bado. Umefanya mtihani, unapewa makaratasi, unakumbuka ile unakumbuka, unasahau zingine, taimu kawaida ndio hiyo imeisha. But I managed to get a C+. Ukitembea huwezi enda straight kama vile mtu wa kawaida anaenda. Unakanyanga hapa, unakanyanga pale. Unaona? Lakini iliendelea kuwa worse day by day. Numbness, especially the left side. Kawaida imeni affect the left side. This side. Yeah, unaganda, mkono, mdomo, ukikula tena ni shinda, unajiuma, na usikii uchungu. Unaona tu damu kwa kijiko ama kwa chakula ndio unajua umejiuma. Unasikia mkonjo, umeketi sawa. Ukiamka kwenda choo imetoka yote na imeisha. You can count from 1978 to 2012, close to 34 years if I'm not wrong. Ndio ijulikane ni multiple sclerosis. Niko naye. Naenda hospitali, unatibiwa hii na kumbe sio hiyo. Changamoto ni kuwa ukiwa mgonjwa na mwili unachoka, huwezi fanya kitu, huwezi enda kuuza, huwezi fanya hiyo kwa biashara yako, inabidi ukae kwa nyumba. Immune iko chini sana. Kwa hivyo ini ka germs kidogo ama ka ugonjwa kidogo inapita na bebe. Sasa hii inasuia at least nisipumue hizo germs na kadhalika. Tu pia inanisaidia kukinga baridi. Sababu ile ugonjwa niko nayo haitaki baridi. NHIF kama wanaweza tusaidia tunaweza shukuru sana. Because the condition is very costly to manage. Dose moja 12, 13,000, 14,000.
Multiple sclerosis, yes, it's a rare disease, but would like to understand what exactly it is because there are people who live with it. And speaking of which, we have Nelly Mugati, who is 32 years old and living with MS. And we have Dr. Dilraj Soki, who is a neurologist. Thank you for joining me. I'll start with you, Dr. It is said to be an autoimmune disease in which the immune system attacks the protective layer of the brain and spinal nerves. Now, what causes this attack and how does this happen in the first place?
A true autoimmune condition is where you can actually measure the autoimmune particle in the blood, for example, that's attacking the nervous system. Multiple sclerosis is not like that. We know that something is attacking the lining of the nerve cells in the brain and the spinal cord, but we don't know why it is, and we can't specifically measure it. And that attack is called inflammation.
Okay, it sounds very genetic, I guess, but I think both are at play here. I'm talking about the genetics and probably environmental factors.
There's a study that was done about 25 years ago where they looked at how often people get multiple sclerosis in different parts of the world. And from that study, they found that in the tropics, there wasn't that much defined, and those who lived further away from the equator, it was more common. And the theory came that could it be related to the vitamin D we get from the sun. However, that theory has now been displaced because we know multiple sclerosis exists all over the world. And we're not entirely sure why it does happen, whether it's an environmental factor, because they have done studies on whether vitamin D levels are low in people with MS, and that's not always the case. They've also looked at whether it runs in families, and it's not purely genetic.
Okay, maybe Nelly could tell us this. Is there anyone who has MS in your family? You are the first.
Yeah.
Okay, and when was it diagnosed?
Actually, I got sick in 2004. I was in high school then. But it was diagnosed like 16 years after. Yeah. Then during that time I was being treated for something else, which was closer to MS, which was ADEM.
For the diagnosis to be made, or when you say you were feeling unwell for many years, what are the symptoms you had?
Weakness. I remember my right leg was numb, completely numb, and I couldn't write. I couldn't use my hands. Yeah.
Multiple sclerosis can mimic a few of other neurological conditions. So, for example, as Nelly has said, her leg was weak and numb on one side. That's an example. You can get one-sided bodily symptoms. So the arm and or the leg become weak or numb. But it's not like a stroke. A stroke happens suddenly. You get a sudden onset of a deficit. Whereas in multiple sclerosis, when you get that attack of inflammation to the nervous system, it happens gradually. So in the space of a day or two, you notice things are just getting worse. But it can also attack any other part of the nervous system. The nervous system includes the brain, the spinal cord, but also the eye nerves. So that's the nerve that connects your eyeball to the brain to project a signal. So people, for example, say that they suddenly could not see out of their eye on one side, and it is painful, it lasts a few days, and that could be an attack of inflammation. In fact, that's classical for what can happen in multiple sclerosis. Suddenly being off balance, if the balance part of the brain is affected. And then lastly, the spinal cord. Some people can get weakness in both legs. So for example, when you get a spinal cord injury, you just become paralyzed, but in multiple sclerosis, you just get this gradual reduction in the power in your legs. You may lose your control of your bladder and bowel, and that itself can also be an attack of inflammation.
You said ADEM was one of the conditions they thought you had. What else did they say they thought you had?
It was mostly ADEM. And I was put on medication for 6 months. It was meant to clear the ADEM, but after 16 years, not 16, 11 years, I was still sick. So I knew that wasn't ADEM.
You also touched on the fact that somebody thought you had TB of the brain at some point?
Yes. And I was treated for not 6 months, but 4 months because I was reacting very badly. Yeah, it made me lose a lot of weight.
To the medication?
Yeah.
Okay.
And I did not have any appetite for food. So I didn't used to eat at all.
What are these symptoms you talked about, or other conditions that also mimic MS a lot?
The commonest would be tuberculosis, for example. I think another reason why there's been a delay in picking up these cases is because of the lack of scanning we had. So MRI scans, magnetic resonance imaging scanning, we only had maybe a handful of scanners up till 10 years ago, and since then we have had a few more. To make a diagnosis of multiple sclerosis, on top of the clinical symptoms I described, you need at least imaging to confirm it too. It is part of making the diagnosis. And I think that's why now we're seeing more and more of these conditions coming up. Nelly's case of this condition initially being diagnosed as TB, at that time you go for what is the most common thing. On a scan, it could look like TB, and you treat accordingly. We do know some people who get what's called ADEM, about a third of them can eventually develop MS, and what was thought to be initially ADEM may have been the first attack of MS, and now it's become MS. Yeah.
The first symptoms you had and now where you're at, did it get worse with time?
There's a time I lost my eyesight on one eye, but after going for treatment, it became better. But the weakness was still there.
In your limbs?
Yeah, in my limbs. Yeah, and still I couldn't write. Yeah, but I had to start practicing how to write again. Yeah, and even I started physiotherapy, which helped a lot. And at 16, I was being taught how to walk again.
Okay. You mentioned there's a point where you had memory loss?
Yeah, okay, not complete memory loss, but maybe just some few things like names, memorizing names. Yeah, or maybe if you're being taught in class and you don't write it down, you might just forget.
Dr. Ari, just reading up on it, 3 types of MS disease progressions. Apparently, these are different in different patients. Which are they?
There's 3 types of MS. There's one called relapsing remitting MS. So a relapse is when you get an attack of inflammation. So for example, as Nelly said, her eye was affected once and then it got better over a period of weeks, maybe months. That's a relapse and then it remits. And the other type of MS is where you don't get relapses, but you just sort of gradually get worse over time. There's no clear, sudden deficit, sudden disability that slowly gets better. You're just slowly, progressively getting worse. And then you've got the in-between one, where the relapsing remitting MS eventually leads to just a progressive MS. So the relapses stop, and you just start to progress slowly, and that's called secondary progressive MS. That seems to be the case in her. She describes clear episodes of leg weakness at some point, eye problems at some point, hand problems at some point that got better, but for a long time she's not had those again. So relapsing remitting MS initially, and then secondary progressive MS thereafter.
You were talking about the various types of MS, and I would like to know the variability of symptoms. Is that dependent on gender, or what causes the variability?
Multiple sclerosis is more common in women. And if you look at the studies from North America, they seem to be a bit more aggressive in those of the sort of African Caribbean descent. So they have to have a more aggressive MS, more relapses. The importance of differentiating between whether someone's getting relapsing remitting MS versus the progressive MS is because for the relapsing remitting MS, you can give treatments to prevent you getting attacks of this inflammation. So you can make things better longer term.
Okay, Nelly, you were talking about how your symptoms have varied through the years. Talk about that and the challenges you had to endure.
I remember when I was around 17, almost heading to 18, I was being retaught how to walk again because I was not feeling my limbs at that time, my legs at that time. So I was being taught how to walk again during physiotherapy, and also how to write again. I had a niece then, and we were teaching her how to walk, and now I'm also being taught how to walk. So it was really, I can't say it was bad, it was a good thing at that time because we were both learning something at the same time. Yeah, but I was feeling kind of embarrassed because I'm meant to be teaching her, not us learning together.
How many of these patients do you deal with that have to relearn, have to go through physiotherapy every time they have a relapse?
That's a very important point, and this is the treatment for neurological conditions, be it a stroke, be it Parkinson's disease, be it multiple sclerosis. So for example, in Nelly's case, the attack of inflammation she may have had could have been in the spinal cord, maybe high up in the neck, that affects the nerves that supply the arms and the legs. And she may have been treated to reduce that inflammation, but once you have an attack of inflammation, it scars that tissue. And then to get that rewiring back again, the nervous system is like electrical wiring. To get it working again, you need to do the physiotherapy to deal with not just walking again, but other issues. So the nerves that supply your bladder and your bowel, they also are supplied from the spine, and that needs to be relearned too.
Let's go back to the risk factors. Just reading up on it, and it said if you have type 1 diabetes, if you're a smoker, you probably would come across or suffer from MS. Is that true?
Smoking may be related, but type 1 diabetes really is not. And you also touched about the family history. And understand you were asking me earlier, can it, for example, go to your children? And as explained before, it's not a purely genetic condition. Yeah, we know that people who have multiple sclerosis, their relatives are slightly more likely to get multiple sclerosis, but that's not a guarantee.
Though they say somewhere that an increase in body temperature can actually worsen the symptoms of MS, true or false?
And that's another interesting phenomenon, and that's called Uthoff's phenomenon. So if you look at the wiring, you've got the wire in the middle, which is conducting electricity, and you have the insulation around it. That's how the nervous system works. And MS works on it, damages the insulation, and if the insulation is damaged enough, it damages the wiring too. And when it's hot, the conduction of electricity is impaired more than when it's cold.
But there's also the sexual bowel and bladder functions that are affected. Any of this ring a bell in your case?
Yeah, like the bladder. You go to the loo many times. Yeah, like maybe when you're sleeping, you can go up to 6 or 7 times.
Nelly touches on probably the most important one so far. When you get the attack of inflammation, it leaves behind that scar. And you have to imagine that when you keep accumulating scars, eventually you're going to continue to lose function. But it causes many other things. Inflammation of the brain that happens time and again, you start to lose your ability to remember everything. You may start to lose the ability to do certain things as well. Managing people with multiple sclerosis is more than just us giving drugs for relapses or giving us something for stiffness. You have to look at the person as a whole, and it requires a lot of input, not just from a neurologist, but our colleagues in physiotherapy, in occupational therapy, depression, anxiety, sleep problems, and that all comes as a package as part of MS.
Which brings up the issue of stigma. You've had to drop out of school to deal with this condition. Which other things have you had to contend with?
Since I was away from school for like 8 years, like when I was in high school, I had to drop out of high school and rejoin another high school. The people I was with when I was in Form 4, they had finished school and the university, but now I'm rejoining school. It was really something that I was fighting against, but I remember my parents told me, you just work hard and finish.
You are in campus and you still contend with these symptoms. Do people understand, or even the lecturers understand, why you have to miss out on classes?
I'm happy that my lecturers do understand. And they actually encourage me, if it's too much, it's fine. You can just wait, just rest a bit, then come back to class. As for people, of course, they ask questions, and some questions you don't have answers to because you don't know what's going on. You know? Yeah.
What does it entail when it comes to treatment?
Those can vary from giving yourself injections once a week, which most people don't like, understandably. There are tablets that can be taken, and then there's other more complicated drugs. The trouble is that because multiple sclerosis is not very well defined in the region, the majority of these, what we call disease-modifying therapies, are not available locally. And if you do require them, they cost a mortgage, you know. And I know, for example, the tablets that would be available free in the UK for multiple sclerosis would cost someone $500,000 a month to use here.
So do you have any sort of boost from insurance companies, NHIF perhaps?
No.
So even when you were using your mother's cover, it did not help?
It did, as when I was in hospital, when I was being, what is it called?
When you were admitted?
When I was admitted, yeah.
Uh-huh.
Yeah, it used to help with paying all the bills and all.
A lot of the people, however, we manage them in clinic. We don't have to admit them to hospital to manage them unless they have to be admitted for certain intravenous treatments. And so for insurance companies, I suppose the majority of them have been useful. On the point of NHIF, the beautiful thing is that NHIF over the last few years has opened up allowing people to get scans. So if your NHIF is up to date and you pay whatever 500 to 1,000 shillings a month for that, you get 2 scans, including MRI scans, for free a year. And the majority of my patients our patients in Aga Khan Hospital who have multiple sclerosis, NHIF pays for their scans.
Clearly, a diagnosis from MS is not the end of the road. You're still here, about to finish your university studies. What would you like people to understand about living with this condition?
It's not our fault. It just came up. We don't know how it came up, and people should actually help people with MS or any other condition which is not normal as other people, instead of stigmatizing them, because that really hurts. Yeah.
Dr. Soki, there are gaps in the health infrastructure. Still have very few neurologists. Again, the health infrastructure in terms of hospitals leaves a lot to be desired. What would be your clarion call to policymakers?
To policymakers, I think it's about having clear pathways. Not everyone can come and see a neurologist in the city, but the clinical officer sitting out there in Marsabit who sees a patient with the optic neuritis, which is the eye inflammation, they should be able to pick it up. And how do you do that? The Ministry of Health, for example, to give guidelines of how to diagnose, then what treatment should be available, and rehabilitation for all patients with these conditions. And I think that'll go a long way in achieving, for example, universal health coverage.
Definitely. Well, thank you so much for speaking and giving your story, Nelly Mugadi, living with MS, and of course, Dr. Nilraj Soki, who is a neurologist. Well, it's always a learning curve for us here on Health Diary. Today, we found out more about MS, and now it's time for a health tip.
Teething of infants can cause a lot of discomfort to the child and also, of course, to the mother. And some of the things you can identify and see if the child is teething, sometimes they'll be fussy and crying, or you'll see like their gums are a little swollen. So there are some of the things that you can do include giving the child a cold pacifier. It tends to soothe the gums a little and makes them feel better. Or you'll see the child is biting on things a lot. So you can just allow the child to chew on whatever the child feels like chewing, as long as you make sure the environment is very clean, because if the child picks dirty things, then they'll start having diarrhea and such things.
Yet another informative episode on Health Diary on multiple sclerosis. Dr. Soki is here to answer any of your questions, and of course, keep them coming through and your suggestions on our social media handles. My name is Gladys Gashanja, and we've been coming to you from the Mivida here at Garden City. Until next time, see you. Yet another episode of Health Diary. Thank you for your conversations.